Moderna's groundbreaking COVID-19 vaccine has led to the launch of the first stages of an HIV vaccine. The pharmaceutical company says participants in phase 1 of the trial have been vaccinated. The biotechnology company teamed up with the nonprofit International AIDS Vaccine Initiative to develop the shot. Both companies hope that the trial will confirm whether the Moderna vaccine can create a protein that triggers an immune response. The study will monitor 56 HIV-negative adults over the next 6 months. So joining us now with more insight is HIV primary care physician and founder of Just Equity for Health, Dr. Stella Safo. Thank you so much for being here.
Thanks for having me.
So break this down. Are you saying here with this study that they will actually give these people HIV and see if the vaccine fights it off?
No, these studies often work where they have folks who may be considered high risk for exposure to HIV. They will give them the vaccine and then they'll follow them over a period of time and they'll see what happens, whether they develop HIV or not. And those who, they'll compare them to a placebo group of those who didn't get the vaccine. And so generally, this is kind of a more of a real world experiment where you're seeing when they're exposed to HIV, do they convert?
Oh, okay, gotcha. So what do you think doctors are hoping to see with just this first round of participants that have been vaccinated?
So, I will say HIV vaccines have been kind of in the making for the last 30 plus years. It's one of the holy grails of medicine that we've been going after for quite some time. And so we, in this first kind of round, expect to see what we want to see with most phase 1 trials, which is to understand how safe it is, to understand if there's any side effects or any kind of major issues that we'll see, and then to see again what happens in terms of its protection. But you have to understand with the numbers like 50 something people, it's not enough to really be able to get to statistical significance. So this is just kind of the first round to understand the safety of this. And then the efficacy question will get answered down the line.
And so how has the Moderna vaccine for COVID actually helped further their research?
So it's one of the things we were most excited about when we were seeing what was happening around the mRNA technology, basically that was being used for both Moderna and Pfizer. It's a different way of delivering um, substances into your body for your immune system to react to using mRNA versus things like adenovirus or other viral vectors. So taking that same idea and applying it to a vaccine, I think the thinking here is, can we overcome some of the challenges we had with previous HIV vaccines, where we would give people a vaccine to prevent HIV, and then their immune system would basically just not be able to really recognize all the portions of it when they did encounter different types of HIV. So what's happening here is that the mRNA technology that we've used for the COVID-19 vaccine gives us options to see what we can do around creating a really robust vaccine when it comes to HIV. But like I said, we've been doing or putting out HIV vaccines for a long time now. And so this is just the latest in the, kind of that history.
Wow, and we know the numbers right now, 1.3 million people in the U.S. are actually living with HIV. So if this vaccine is successful, how would that change how we used to see something known as a death sentence and kind of give them a renewed hope of life?
So the good news is that, HIV medications now for the last 35, 40 years have really progressed. So we started you're absolutely right, the first 10 years of the history of HIV where it was a death sentence. And since 1996, we've been blessed with medications that we know work. The question is, will you take them? Will people take them and take them lifelong in order to give them the same life expectancy as someone who doesn't have HIV? The beauty of a vaccine is that if it can prevent you from getting HIV, it's even better. It's why we love vaccines. And that number you gave of over 1 million people living with HIV in the US, many of those individuals are coming from Black and Brown communities. So it hits our communities harder. So the hope is that when these vaccines are developed one day, and I believe that they will be, that we do the due diligence to get them to the communities that are the hardest hit. Because what happens a lot of times with HIV and many other conditions is the communities that kind of need them in some ways the least are the ones who are getting them the most. And so there's a real equity question here of how do we make it fair and get it to those communities that are the hardest hit so that they can be protected going forward. And I think if a vaccine is developed, I'd really want us to think about that design element of who's really at the front of the line to get access.
And one of the reasons a lot of people don't go and get those vaccines that does help that they need is because of some of the stigma surrounding HIV. So can you talk to us real quick, we only have a few seconds left, about the stigma and how that's changed over the years with HIV?
One of the really nice things is that now if you have HIV, because you take medications, no one can tell that you have it, and so it isn't quite an obvious, condition. Many people are having HIV who are walking around, you'd never know. So I would say that the stigma definitely remains, and it remains in some communities more than others. For the most part, though, you should assume that there are people among you who have HIV that you don't know about, and that's okay because HIV is like any other chronic illness that we're treating, and we should continue to think of it that way.
Well, we wish you much hope with this study and all your continued work. Thank you so much for your time.